This program has been made possible in part by the following sponsors: David and Mark Goodman, the Vancouver Courier newspaper, Vancouver lawyers Dumoulin Boscovich, Well, we have elections upon us. Of course, the federal election is in full flight. And then the NDP are trying to find a leader provincially. They're pounding the bushes to find a good one. And of course, Premier Christy Clark probably will call a provincial election. And then when that's barely over, we'll be confronted with municipal elections. But there's a great big elephant in the room for all of these politicians, and frankly, very few of them, if any, are addressing this issue. It's only the biggest public policy issue in the nation, and that's healthcare. Well, David Dodge, the former governor of the Bank of Canada, only the other day, as reported today by Terence Corcoran in the National Post, said at a speech delivered to the C.D. Howe Institute that Canadian universal health care is fiscally unsustainable. He called his speech the chronic healthcare spending disease. Well, let's argue that position. If anybody should be good at arguing that position, it is our guest, Dr. Brian Day, who is the owner and head surgeon of Cambie Surgical Centre here in Vancouver. Dr. Day, as you all know, was the head of the CMA, the Canadian Medical Association, which is the almost union of doctors for 2007-2008. He's known to his detractors as Dr. Prophet, and to his friends as Dr. Prophet, as in Mohammed or Moshe, I guess. Hello, Dr. Day. Hello. Nice to see you. And oh, by the way, my shoulder, no, I'm just kidding. Okay, so we've asked you to prepare 10 questions, top 10 questions that you might ask a politician, now that we have all these elections, about healthcare, and you've done exactly that. So how we'll play this game is I'll read out the question, and you tell us what your real thoughts are about these questions.
Right.
Okay? So let us begin, if I can find my list. Let us begin with question number 10. Short form. Most Canadians have some kind of private insurance. Why don't we all?
Well, the short answer is we should. I actually wrote an editorial in the Vancouver Sun, an op-ed in the Vancouver Sun in February on this very topic, that we Canadians kind of think that we have an egalitarian, equal healthcare system, and yet drugs, dentistry, physiotherapy, all the things that an ambulance when you have a heart attack, yes, these are not covered by our government health system.
That's right. I paid $80 last 2 years ago for an ambulance.
So by definition, the fact that almost a third of Canadians don't have that insurance means we don't have the system that a lot of people think we have. And I think that, and this actually surprises some people, I think in terms of coverage, we have to give that kind of coverage, and if they can't afford it, yes, then the government has to cough up for it to those that can't afford that $80 a month. And the position I take is fiscally responsible, because actually it costs a lot of money to keep people waiting for healthcare. It actually costs more. So I think particularly with drugs and dentistry, we have the data on that.
Okay, drugs and waiting lists are coming up on our list. So let's go to question 9. Question 9 asks, should government access your medical records without your consent? I wasn't aware that government could. Is that the case?
That's absolutely the case. And in fact, I would imagine most British Columbians don't realize that governments government agents, if you like, have access to your private medical record.
But Brian, why would someone want to read my medical record?
Well, their excuse is to make sure that that the services that they're being billed for are actually being done. But I have had personal experiences where where these things have been used for quasi-political reasons. I mean, I wrote an article on this I called it the medical KGB, because what I object to is that not only does the government have the right to look through your personal medical record, and that might include records on mental illness,
Yes.
on abortions,
Yes.
on
Yep.
on a whole host of things.
Your most intimate private life.
Right,
Yes.
and not only do you not need to sign a consent for that,
Yes.
but they don't even need to tell you that it's being done, and I find that objectionable. I think it's something that we need to change in the laws of British Columbia.
Okay. Question number 8 that you might ask someone who's running for office. Prescription drug costs are enormous. They're growing exponentially. How would you, Mr. or Ms. Politician, hold those costs or bring down those costs?
Well, several ways. First of all, I think that we know, as doctors and pharmacists know this, that a lot of drugs go wasted. With you can go to the cupboards of most homes and find a lot of wastage, drugs that haven't been used, that have been prescribed and not used. But there are methods, there are issues with our previously used method of funding pharmaceuticals in BC and in most parts of Canada. I think we've seen, if you look at the experience in Quebec, they have introduced a more fiscally responsible method of.
What do they do?
Well, they basically have a better control of drug costs. I believe, funnily enough, even though I believe in a big role for the private sector, I do believe the private sector must have strict regulation by government, and that's something.
But this is always the problem in any industry, isn't it, Dr. Day, that we like government to stay out of, the business of business. You'll be okay. You could just put that back in your pocket. You'd like government to stay out of the business of business, and they should regulate, but often the problem is government doesn't really do judicious oversight.
Right.
And certainly it can be argued that the biggest businesses in the world, armaments, illegal drugs, oil, and pharmaceuticals.
Right. I think one of the things that a lot of Canadians probably don't understand is that with the so-called generic drugs, which are those that have the patent's been used up, we actually pay more than they pay in the United States for those drugs. And that's an example of poor fiscal management by governments. I honestly think there's a role for government regulation, but the government has to understand that they have limitations in their ability to run and operate programs, and they're sometimes better off to let someone else run the program and they just oversee and regulate it. And we in Canada pay more for the generic drugs than we should be paying.
Okay, that's not good to hear. Let's go to question 7. Workers' compensation patients are often treated faster and more efficiently. Why aren't we? Why aren't all citizens? Why don't we all get this kind of response?
Well, again, we should be, and we'll address that a bit later, but it's not just injured workers.
Yes.
Injured workers are really operating under a European-style hybrid scheme of healthcare delivery where there is they have a blend of public and private sector funding and delivery. A lot of people think the workers' compensation is government funded. It's not. It's funded by the employers of the province who pay premiums. There is no tax dollars going into the Workers' Compensation Board. So they have to be fiscally responsible to the employers. I mean, they said...
You operate a private surgery. Do you have a workers' compensation
Workers'
clients?
compensation, that's how we began
Really?
by targeting. We began by targeting injured workers. But The other group that I like to point out have similarly are the federal police force, the RCMP, are exempt from the restrictions on accessing non-government healthcare, and even more dramatically, if you're in jail.
I was going to say, prisoners.
Prisoners.
Yeah.
Federal prisoners do not have the constraints put on the public who are on it. I mean, I've often argued what I'm fighting for is to give Canadians who are not in jail the same rights that people who are in jail have, and that is the freedom to.
And what about high-profile athletes?
High-profile athletes too. I mean,
if a knucklehead, pops a knee while he's going into a board or something in the next game, he's going to get responded to quickly.
Of course he will, or she will, and we. I mean that. I think everyone understands when you bring up examples like that, because no one would expect a multi-million-dollar athlete to wait a year to see a specialist and then another year to get into hospital. That's 2 years of paying them millions of dollars.
But a 64-year-old man or woman in Pitt Meadows will.
Exactly, and again, these are all examples of how unequal our health system is, and that's what politicians will try and sell you on the status quo because it's equal for everyone. It is far from equal for everyone.
Okay, let's go to our last question for this first 15 minutes of the show. Question number 5. Can we learn from various European countries, and you've cited France, Belgium, Germany, among others, who have universal access and no waiting lists? What is there to learn from them? How have they done it?
Well, there's everything to learn from them, and no one is the model. What I would do if I were a
king for a day,
is I would look at the best practices of the top performing health systems. I mean, of the top 20 health systems in the world that are ranked in the top 20, 17 are European countries, all of which have universal health care and none of which have wait lists. Or virtually no wait lists. And most of them also have dental care and drug care as part of their health systems. When a European Consumer Group ranked health systems in Europe, they put Canada in as an example of a country with a universal health system. And we came out ranked 23rd overall in quality and 30th last in value for money.
We're going to go to that.
So the problem is Canadians and British Columbians are not getting value for money for the amount we spend on healthcare.
Yeah. Okay. Well, look, because I'm a very vain, egocentric guy, I didn't put my glasses on, and I turned 2 of the questions around. So I ran question 5 as question 6. So we'll pick that up when we come back. Our guest is Dr. Brian Day, and the game we're playing today is the top 10 questions you should ask your political candidate about healthcare. Healthcare is the #1 issue in the country. It devours about 50% of all budgets, and we are not addressing this issue substantially as we should. Just a quick reminder, if you want to send us emails of any kind, or you want to look at Twitter, Facebook, and all of the usual social media stuff, go to davidberner.com and you'll find all of those accessible right there. We're going to take a little break and say thank you to some of the lovely people who help make it possible for this show to continue here on Shaw Community Television, Cable 4.